Chapter 38, Activity and Exercise. Promoting activity and exercise is a principle that a nurse should apply in the care of patients throughout all the healthcare settings. When the nurse promotes activity, it's important to make sure that it is done so in a safe as well as efficient manner and designed especially for patients who are functionally impaired or in need of the nurse's assistance. Walking, turning, lifting, and carrying are all common actions that are used in delivering nursing care. These activities also pose risk. Healthcare workers frequently incur injuries, back injuries, and overexertion when moving or lifting patients incorrectly. The nurse should apply safe patient handling standards and principles to reduce the risk of injury to the patients and themselves whenever assisting patients with activities. Movement is a complex process that requires coordination between musculoskeletal and nervous systems. As a nurse, you will consider how a patient's physical and psychological conditions affect the body's movement. Body mechanics is a term that describes the coordinated efforts of the musculoskeletal and nervous systems. The term body alignment and body posture are similar and both refer to positioning of the joints, tendons, ligaments, and muscles while the individual is sitting, standing, or lying. Body alignment means that an individual's center of gravity is stable. Correct body alignment will reduce strain on musculoskeletal structures, aid in maintaining adequate muscle tone, promote comfort, and contribute to balance and conservation of energy. Without balance control, the center of gravity is displaced. Weight is the force exerted on a body by gravity. The force of weight is always directed downward, which is why an unbalanced object will fall. The greater the surface area of the object that is moved equals greater friction. A larger object produces greater resistance to movement. Also, the force exerted against the skin while the skin remains stationary and the body structures move will cause skin tearing, known as a shear. The patient will need to go to rehabilitation after their surgery. What concerns as a nurse would you have for the patient? The nurse realizes the importance of assisting the patient in prompt, immediate post-op recovery and engaging him in a steady, progressive physical therapy program. The skeletal system provides attachment for muscles, ligaments, and the necessary leverage for mobility. The skeleton is the supporting framework for the body and is made up of 4 types of bones: long, flat, short, and irregular. Bones are vital for mobilization because they are firm, rigid, and elastic. When 2 or more bones attach, it is referred to as a joint. Each joint is classified according to the structure and the degree of mobility. The 3 classifications of joints are cartilaginous, fibrous, and synovial. Ligaments, tendons, and cartilage support the skeletal system. Ligaments are white, shiny, flexible bands of dense, fibrous tissue. They serve to bind joints and connective bones and cartilage. A ligament is one type of collagenous fiber that intertwines in an irregular and swirling pattern to form thick connective tissue. Tendons are white, glistening, fibrous bands. These occur in various lengths and thicknesses. These connect muscle to bone and are strong, flexible, and inelastic. Cartilage is non-vascular, supporting connective tissue, located mostly in joints and thorax, trachea, larynx, nose, and ear. It has the flexibility of a firm plastic material. Skeletal muscle cells have the ability to be stimulated or excited, and then they can respond to regulatory mechanisms like nerve signals. Skeletal muscles are composed of bundles of skeletal muscle fibers that routinely extend the entire length of the muscle. These muscle fibers will contract when stimulated by an electrochemical impulse that travels from the nerve to the muscle across the neuromuscular junction. Skeletal muscles routinely act in groups, resulting in movement produced by coordinated action of several muscles. Proprioception is a muscle sense that makes an individual aware of the position of the body and its parts, including alignment, orientation in space, and muscle stretch, without even having their eyes open. Body balance occurs when a person is properly aligned with a relatively low center of gravity, balanced over a wide, stable base of support. An active lifestyle is important for maintaining and promoting health and psychological well-being. The best program of physical activity is a combination of exercises that produce different physiological and psychological benefits. Isotonic exercises, including walking, swimming, jogging, and biking, cause muscle contraction and change in muscle length. Isotonic exercises enhance circulatory and respiratory functioning. They will increase muscle mass, tone, and strength. Also, they promote osteoblastic activity that combats osteoporosis. Isometric exercises involve tightening or tensing muscles without moving body parts. There are principles of safe patient transfer as well as positioning. Use mechanical lifts and lift teams when patients are not able to help or assist. When the patient is able to assist, remember these principles. The wider the base of support, the greater the stability of the nurse. The lower the center of gravity, the greater the stability of the nurse. The equilibrium of an object is maintained as long as the line of gravity passes through its base of support. Facing the direction of movement prevents abnormal twisting of the spine. Dividing balanced activity between arms and legs reduces the risk of back injury. Leverage, rolling, turning, or pivoting requires less work than lifting. When friction is reduced between the object to be moved and the surface on which it is moved, less force will be required to move it. Obesity deserves special consideration because it is a international public health problem that is affecting adults and children. In the United States, researchers have found that obesity prevalence to be 16.9% in the age group of 2 to 19 years and 8.4% in the age group of 2 to 5 years, with an upward trend in prevalence in children with the severest forms of obesity. Risk factors for childhood obesity are many. Poor diet habits, playing video games with an excess screen time, and lack of exercise are significant. According to the Centers for Disease Control and Prevention, The prevalence of obesity among adults was 39.8% affected, which is about 93.3 million of the United States adults between the years of 2015 and 2016. Adults are more at risk for obesity due to a lack of healthy diet habits and limited physical activity and exercise. Manual lifting and transferring of patients has contributed in the past to a high incidence of work-related musculoskeletal problems and back injuries in nurses and healthcare staff. Ergonomics is the design of work tasks to best suit the capabilities of the workers. In the case of safe patient handling and mobility, it improves the assessment, the use of mechanical equipment, and safety procedures to lift and move patients safely. Throughout the lifespan, the appearance and functioning of the body undergoes change. The knowledge of growth and development programs will prepare the nurse to anticipate the types of activities that patients of all ages are capable of performing. There are common chronic health conditions among young adults. Heart disease, stroke, asthma, arthritis, COPD, diabetes, depression, hypertension. Physical inactivity is a modifiable risk factor for the development of type 2 diabetes. Prevention and treatment programs need to focus heavily on exercise and be tailored to the activity tolerance of the individual. There should be support of physical activity through formal programs in churches, schools, and agencies within the Black and the Native American communities. There should be incorporated motivational factors in exercise programs, such as providing a healthy snack or meal for participants, and furnishing each individual with a log to monitor weight loss as well as blood glucose levels. To understand activity tolerance, physical fitness, and the effects on patients, the nurse integrates knowledge from nursing and other disciplines, previous experiences, and information gathered from patients. As the nurse plans the patient care, the nurse will consider the relationship among a variety of concepts to provide the best outcome for the patients. An assessment for determining a patient's activity and exercise needs to be comprehensive, consider the patient's physical condition, activity history, socioeconomic resources, and readiness to exercise. The nurse will critically analyze the assessment findings and also determine the patient's personal goals regarding activity to ensure that the nurse makes patient-centered clinical decisions required for safe and effective nursing care. During the assessment process, the nurse will consider normal physiologic changes in growth and development and any deviations to the expected based incomes on the patient's health condition. Perceived self-efficacy is a judgment of capability and applies to an individual's willingness to engage in an activity like exercise. The outcomes people anticipate, such as from the exercise program, will depend on their judgments of how well they will be able to perform in a given situation. The nurse will assess the patient's socioeconomic resources for being able to engage in an activity or an exercise plan. The socioeconomic factors will impact an individual's readiness or ability to exercise. The nurse will assess the patient's physical condition to determine the readiness to exercise. This assessment will include status of body alignment, muscle strength and coordination, and integrity of joints and other structures using physical examination techniques. The nurse will assess the patient's alignment during standing, sitting, and lying. The assessment of the body alignment has the following objectives: to determine the normal physiologic change in the body alignment that result from growth and development for every patient, identifies deviations in body alignment caused by incorrect posture, provides opportunities for patients to observe their own posture, identifies learning needs for patients to maintain correct body alignment, obtaining information concerning factors that could contribute to incorrect alignment, the adequacy of a patient's mobility will affect their coordination and balance while they are walking, their ability to carry out activities of daily living, and their ability to participate in any exercise program. The assessment component of mobility has 5 areas: sitting, standing, range of motion, gait, and exercise. What nursing diagnoses do you think should be included? Consider impaired physical mobility related to pain, muscle weakness, and limited joint movement. A comprehensive patient assessment provides clusters of assessment findings to support the nursing diagnosis. Accuracy is essential when selecting the nursing diagnosis. When patients have problems with activity and exercise, nursing diagnoses often become focused on the ability to move. In the case of negative or problem-focused diagnoses, the related factors or the etiology will direct the nursing interventions. Critical thinking in the planning phase will ensure that the patient's plan of care integrates all the patient information and it is patient-centered. Professional standards are especially important to use when developing a care plan that is evidence-based. These standards will often establish scientific guidelines for selecting effective nursing interventions. After identifying the appropriate nursing diagnoses, the nurse and the patient will set goals and expected outcomes to direct interventions. If the goal involves the improvement in the patient's level of activity, integrating the patient's goal is critical to ensure their compliance and adherence to the program. These are the goals for the patient and the expected outcomes of the therapy. There are physical activity guidelines for Americans. For the adult population, they need to move more and sit less throughout the day. Some physical activity is better than none. Adults who sit less and do moderate activity to vigorous activity gain some health benefits. For a substantial health benefits, adults should do at least 150 minutes a week for moderate intensity or 75 minutes to 150 minutes of vigorous intensity. Preferably, some aerobic activity should be spread throughout the week. Additional health benefits are gained by engaging in a physical activity beyond the 300 minutes or 5 hours of moderate intensity activity. Adults should also do muscle strength activities of moderate or greater intensity that involve all the muscle groups on 2 or more days a week. The older adults also have guidelines. The key guidelines for the adults do apply for the older adults. Also, as part of a weekly physical activity, the older adults should do multi-component physical activities that include balance training, aerobics, and muscle strengthening activities. Older adults should determine their level of effort for physical activity relative to their level of fitness. Older adults with chronic conditions should understand whether and how their conditions affect their ability to do regular physical exercise. When older adults cannot do 150 minutes of moderate intensity aerobic activity every week because of chronic conditions, they should be as physically active as their possibilities and their conditions will allow. A patient with a long history of arthritis complains of sensitivity and warmth in the knees. To determine the degree of limitation, the nurse should assess posture, activity tolerance, body mechanics, range of motion. The answer is D, range of motion. Recent efforts have been made in hospitals to increase inpatients' activity and mobility levels as soon as possible to prevent deconditioning and other complications related to immobilization. Typical early mobility protocols will include specific assessments for each level of mobility, with patients progressing from passive and active assistant ranges of motion exercises to sitting on the side of the bed, transferring and sitting in a chair, then progressive ambulation. In isometric exercises, the patient will tighten or contract the muscle group for 10 seconds and then completely relaxes for several seconds. Repetitions are increased gradually for each muscle group until the isometric exercise is repeated 8 to 10 times. Patients should be instructed to perform the exercises slowly and to increase repetitions as their physical conditioning improves. The earliest intervention to maintain or improve joint mobility for patients, and one that can be coordinated with other activities, is the use of range of motion exercises. There are 3 types of range of motion exercises. There's active, active assisted, and then passive. Orthostatic hypotension is a drop in systolic pressure by at least 20 millimeters of mercury, or a drop in diastolic pressure by at least 10 millimeters of mercury within 3 minutes of rising to an upright position. The individuals at higher risk are those who are immobilized, those who are on prolonged bed rest, older adults, and individuals with chronic illnesses like diabetes mellitus and cardiovascular disease. Signs and symptoms of orthostatic hypotension will include dizziness, lightheadedness, nausea, tachycardia, pallor, and even fainting. Orthostatic hypotension usually stabilizes quickly, but if the patient develops dizziness lasting 60 seconds, the patient should be returned to bed. If a patient is falling, the individual that is ambulating with them should stand with their feet apart, shoulder width, to provide a broad base of support. They should extend one leg and let the patient slide down that extended leg to the floor. And then they should bend at the knees to help the patient lower to the floor without falling. Making sure that the patient uses the walker correctly will ensure safe use of the assistive device. The nurse should provide instructions in a quiet environment and give written instructions in large, easy-to-read print to enhance the learning for the older adult. Assistive devices are recommended for patients who are unable to bear full weight on one or more joints of the lower extremities. Other indications for use are instability, poor balance, or pain upon weight bearing. An assistive device can reduce the risk of fall, decrease pain with mobility, and improve balance. A walker is a lightweight, movable device that stands about waist high and consists of metal frame with hand grips and 4 widely placed sturdy legs with an opening on one side. Canes provide less support than a walker and are less stable. The most common cane is the straight-legged. The length of the cane should be equal to the distance between the individual's greater trochanter and the floor. The patient should keep the cane on the stronger side of the body when in use. Crutches are often used to increase mobility. The use of crutches is routinely temporary. When an individual is fitted for crutches, the nurse needs to ensure that the length of the crutch is 2 to 3 finger breadths below or between the axilla and the top of the crutch. This positioning will permit there to be no pressure on the axial plexus to prevent any nerve damage. These are examples of crutch gaits. A is a 4-point alternating gait. Solid feet and crutch tips show the order of foot and crutch tip movement in each of the 4 phases. B is a 3-pointed gait with weight bearing on the unaffected leg. The solid foot and crutch tips show the weight bearing in each phase. C is a 2-point gait with weight borne partially on each foot and each crutch advancing with the opposing leg. The solid areas indicate the leg and crutch tips that are bearing weight. There are various benefits of exercise training depending on the symptom. It will increase the oxygen carrying capacity. It will decrease hypertension, decrease dyslipidemia, decrease inflammation, decrease type 2 diabetes, increase heart functioning, decrease ischemic injury, increase vascularity, increase metabolism. To evaluate the effectiveness on nursing interventions to enhance the activity and exercise, the nurse should make comparisons with baseline measures that include the pulse, blood pressure, oxygen saturation, patient strength, fatigue level, and psychological well-being. For safety in patients and mobility, the nurse needs to know the patient's level of mobility. The nurse should understand how to use the equipment, determine if there's any transfer equipment necessary, assess the patient's risk for level of intolerance, and determine if any ancillary bodies will be necessary to assist the patient.